going on. So, pardon me.
You're now live.
Now we're live. Hopefully, after I said the S word.
Otherwise, nice shocking behavior. Sometimes grab some viewers.
So
Everybody, welcome
hilarious.
to Blonde Biased. I'm Theresa Paganini. I am I'm a health coach. I'm a behavioral change specialist and weight management specialist, and I help people that struggle with obesity develop a healthier relationship with their body, with food, so they could go back to enjoying food responsibly, so they can continue to lose weight and maintain it and enjoy it all at the same time.
Yay. Yeah. And I'm Dr. Katie Schneller. I'm a naturopathic doctor based out of Tempe, Arizona, and I treat a ton of gut health, a ton of autoimmune, but in general, kind of help my patients put together the puzzle pieces of their life and their medical history. Lots of people are seeing tons of specialists. Lots of people aren't treated super well or believed about what's going on. So I'm the doctor that's actually going to listen to you and give a shit. So,
and she does a great job at that.
Yes, yes. And this week on Blunt and Biased, we are talking about high cholesterol. I'm super excited. And it is super common, very rampant. And I think a lot of people are instructed by other doctors just to go on medication. And that's kind of your only resort.
Or because they have high cholesterol, they focus just on the cholesterol number on the nutrition label.
Mm-hmm.
When I think an important topic of conversation for us, and probably a good starting point, is there is good cholesterol, there is bad cholesterol.
Sure.
And it's not necessarily cholesterol itself that causes high cholesterol. There's other factors, like saturated fat actually has more impact on it. And so like what causes it, what doesn't, dietary versus genetic, that kind of stuff. But there is good and bad cholesterol. So I'll pass that baton off to you.
Sure. Yeah, I'll give us kind of like the foundational groundwork. So anytime that you've had a lipid panel, that is your cholesterol panel. Usually in there are at least a few things. First of all, is going to be your total cholesterol, and that comprises your good and your bad cholesterol. The only good cholesterol that we have really is called HDL. So I just think H for happy. The other three are triglycerides, VLDL, and LDL. VLDL turns into LDL, and all three of those are responsible for depositing cholesterol or plaques into the walls of the arteries. Of course, there are places where there's really nowhere that we want that, right? But one of the biggest concerns would be to the main artery, the coronary artery of the heart. That's how people have heart attacks from this. But when you're figuring out whether you have high cholesterol, a piece of that really needs to be all broken down so that you can see, is my total high because my good is high? Or is it high because my bads are high? Is there a certain combination of what's going on? So yeah, that's kind of the background. But we do need cholesterol in general. It is a coating around our nerves, and it's also the main precursor to all of our sex hormones. So we do need some cholesterol. In fact, I treat a lot of low cholesterol too, just because people think they should be avoiding it.
Yeah. And so the healthy HDL, healthy or happy cholesterol, what's a good range for that one? Like the minimum is 50, right?
I think clinically abnormal or clinically is anything below 39 actually.
Oh,
so
really?
Yeah, but I like to see it at 60, right? Yeah, I like to see it at 60 or above.
Okay. And then, so for example, my mother, right? We have genetic high cholesterol in my family. And so her LDL, which is the bad cholesterol, her LDL is what the total cholesterol should be all by itself.
Whoa.
It's 200.
Okay. Yeah. And so is she on a medication or?
She's not, she refuses, but yes. But, my LDL, so being a health coach, being super health conscious, eating well, exercising, my HDL is it's tough to get it to 50. And my LDL is usually at about 160, 170. So I am always above 200.
Yeah.
Never by a ton.
Yeah.
But for someone who's healthy, right, my numbers are genetically not fantastic either.
Yeah. And that's tough. I think there's a lot of discrimination around that, as there is around other things like obesity and weight gain and things like that. But with cholesterol, there is it's called familial hypercholesterolemia. So you could have high cholesterol, not because of your dietary choices. And in fact, there's oftentimes not a whole lot you can do really dietarily wise to move that number a whole lot, because genetically you just are going to have high cholesterol. So you have to
Yeah.
mitigate your risk.
And so, and Dr. Katie's going to bop me in the face right now. But
What?
so I always tell people, like, that's my norm. So I
Hmm.
don't believe I need medication just because it's showing high, because that's my body's normal. So it's not the standard normal. Like my
Mhm.
temperature is always lower. I'm always in the 97s. That's my norm.
Mhm.
So like if I am at 98.6, I technically have a fever for me because I'm never there. So
Yeah.
I don't get concerned about my cholesterol, even though it shows as high, because that's my normal. And as long as it stays around there, I'm like, I'm good. I'm good.
I
Is
think
it
if,
bad?
if you're steady at something that's a little clinically elevated, potentially that's okay. But you'd want to, once a year, double check on other values, things like CRP cardiac. This is a specific marker that assesses 50% of your risk for developing coronary atherosclerosis or plaque to the
Ooh.
main artery of the heart. So this would be a good factor to get to see, or a good blood draw to have, to see where your risk is for developing plaque to the main artery of the heart. And, of course, if you're completely asymptomatic, then potentially that's okay. But that's more how people in other, countries without advanced medical systems like we have in America can just die of heart attacks because it's kind of silent.
Yeah.
If you're not getting your blood work drawn once a year at least, then, which includes a cholesterol panel, then you may not even know that you have high cholesterol.
All right. And so what was the name of that test again? I'm going to put it in the comments.
Yeah, CRP cardiac. It's also called high sensitivity CRP, and CRP stands for C reactive protein.
I don't have my glasses on. This could go all wrong. Let's see what actually gets posted. Is that right?
Yes.
I can't listen and type at the same time. So I was like listening to you and still trying to type, and I was like, God knows what I
Hilarious.
just
Yeah.
Anyway, so that's good to know, because CRP cardiac I am not familiar with. And is that part of, like, if you were to go for a physical, is that a standard? No, so you
No,
have
not
to
usually. Yes,
ask.
I just had a follow-up today with a patient whose cholesterol was completely fine. Perfect. In fact, her HDL was over 70. Her total cholesterol was under 180. Fantastic. But her CRP, which should be somewhere, by the way, between 1 and 3, under 1 is the best, but it was 42.
Oh my God.
Yes. And so I was like, whoa, hey, so there's some source of inflammation that we have not found yet. So, yeah, so it's good. It's part of my standard routine blood work for preventative work, but not your typical, your primary care. You might get a complete blood count looking at your red blood cells, your white blood cells, a comprehensive metabolic panel, or a CMP, which looks at a few electrolytes, kidney function, liver function, things like that. But standardly, no, CRP does not tend to be drawn just for no reason.
Okay. All right. Good to
Yeah,
know. So we got to ask, guys. We got to ask. We got to take control of our own health. So now
exactly.
let's talk about, if it is high, whether, and I know dietary versus genetic, it's going to be a somewhat slightly different answers. But so what are some things besides medication? Because I am not a medication kind of gal.
Yeah.
Obviously, as somebody who's in the wellness side, I know that eating a high fiber diet, limiting your saturated fats, keeping yourself on a steady exercise regimen, these are things that all help with cholesterol, as well as other or heart related diseases. Let's say that. But what else?
Yeah. So there's a number of herbs that can actually be helpful, but when it can either be, so for example, onion and garlic. I always tell my patients as much onion and garlic as your breath can tolerate, or someone around you can tolerate on your breath. And you
Okay.
can do that herbally. You can do encapsulated. It's bad and you get burps and stuff. It's really not pleasant. Or you can just eat it dietarily. But one of the strongest things that we can do naturally for high cholesterol is something called red yeast rice. Now, the problem with red yeast rice is that it depletes something called coenzyme Q10 or CoQ10, and this is protective for the heart. So if you're somebody who has high cholesterol, you want to avoid medication, and you start to go on red yeast rice, you need to be taking CoQ10 about 2 hours away
Okay.
from your red yeast rice. And there's not certain dosages really that I'm comfortable saying, because it really does depend on your numbers.
Okay.
Yeah. So that's one thing. Those are a few things. And then, if somebody's cholesterol isn't super high, they just need a little bit of balance outside of dietary factors, which I think we should go into a little bit more on your side of things in a second, are omega-3s. So we want really ideally between 2 to 3 grams of omega-3s and an EPA to DHA ratio of 2 to 1. We want more EPA than DHA. That's anti-inflammatory versus pro-inflammatory. We do need some inflammation in order to heal things and for our body to operate normally. But high omega-3s can be really helpful because a number of reasons, but omega-3s help preserve vascular integrity. They can reverse kidney disease. They help your eye health. They can correct menstrual irregularities. Really, when people come to see me and their lab work is perfect, which is rare, but it does happen, and they don't really have any symptoms, it was maybe just a preventative draw, something that I put them on is an omega source. Really, everybody can and probably should be on them. Just watch out for like pre-surgery and if you're on blood thinners and things like that. So again, none of this is medical advice, but this is
always so many caveats.
Always the caveats. But omega-3s can really help with cholesterol as well.
Yeah. So I think, and we always say this, but I'm not sure we have on this episode yet, but if you do have high cholesterol, reach out to Dr. Katie, reach out to your naturopath, reach out to your MD. And before you decide to do anything, talk to them, because you don't know what's going to interact with medications you're currently on. You don't know, like, for example, the red yeast rice, would you have known? You may have read an article, red yeast rice is great for cholesterol, and it never mentioned it depletes CoQ10. Hold on. My Roomba is about to go off. Stop. I'm in a podcast. Hold on. We're connecting.
Does it sing to you when it's turning on?
Yes.
That's funny.
And then it's just loud as hell. And I just hit pause and then it disappeared. So I'm like, oh no. Anyway, so definitely see your health professional before you just start taking any supplements.
Yeah.
Because
please stop following instructions from Instagram. Please, 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 please. From Reels, from TikTok, whatever. I don't care if it's a doctor. Please see your own doctor or see your own healthcare specialist.
Right. Like even us. Don't trust us because we don't know your medical background. We're talking in generalities.
Yes.
So, trust us once you see us one-on-one and we can see and get your medical history. So, all right, that was my little plug right there. All right, so I've got helpful for cholesterol, garlic, onions, red yeast rice, with the understanding you should also take CoQ10 as a supplement because it depletes omega-3 fatty acids, 2 to 3 grams. Is that per day?
Per day.
That's what I thought.
And pretty much nobody is getting that amount. If you're buying your omega-3s at Costco, you'd have to take I think 8 of those pills. And also omega-3 sources are things like fish oil. So if you're going to do an encapsulated fish oil, if you're getting fish burps, there are 2 things you can do. You can freeze the capsules, which lessens the chance of that. But if it's really fishy, it's probably rancid. So stop taking that. Yeah.
I know when I was taking it, because I'm a bad girl and we both know I suck at supplements, I have thousands of dollars of them in my cabinet. I just don't take any of them. But the omega-3s I used to try to take before bed because I was like, I can't stand it. And I got a medical grade from a doctor, and I was like, okay, yeah, it's good for me.
Great. Horrible.
Yeah, but if I took it before bed, then I just slept through any of the burps I would have had, and I was like, okay, that's better.
That's good. Yeah, that's really good. A few other herbs that can help too that I'd like to mention is something called, good luck spelling this, Commiphora mughal, or Google. I know. I'm sorry. Guggal.
What was the first part?
Commiphora, Commiphora. Next
Wait,
word.
Did all of you see that?
Mukul.
You're like, duh. And I'm like, okay. All right. Commai.
Commiphora. And this particular herb lowers LDL and VLDL while raising HDL.
Oh, I should do this. All right. What was the M word? Mughal?
Mukul. Mukul.
She's so smart, guys.
All right.
Favorite part was the shrug, though. What do you mean? Had to spell camphora.
Camphora, obviously, obviously. Let's see what else. Eleutherococcus.
Okay, okay, now you're just being mean.
Okay, I'll type them in here later. But this one lowers cholesterol total. Panax ginseng. You probably know ginseng.
I know ginseng.
Ginseng reduces your total cholesterol and triglycerides and increases HDL. So that's good. And then one of my favorite double hitters for cholesterol and blood sugar is called Vaccinium. It's Vaccinium. That one's
Got
not
that
too
one.
yeah, reduces your total cholesterol again and triglyceride levels. So essentially, like if your high cholesterol is coming just from your triglyceride levels, this is a good one. And if you have elevated blood sugar, so if your hemoglobin A1C, that's your average blood sugar over 3 months, is elevated into the pre-diabetic or diabetic section, then Vaccinium is a nice herb.
All right. And once again, you want to get these from a reliable source. I talked to a naturopath like Dr. Katie before just going to like Sprouts or Costco, and I don't even know if you can find those there, but
I don't know either.
All right. So I got all of them except for the Acoccus one.
ELE.
Oh, ELE.
UTHERO COCCUS.
Got it. All right. We're going to post that. Oh my God. Good luck to all of you.
And you can find a lot of blends with, these herbs and more in them. Like if something says cholesterol, like it probably, cholesterol help or something, like it probably helps. But again, please don't do this on your own.
Yeah.
Yeah.
All right, cool.
What about foods wise from your side? Can you get more specific on, because I always say trans fats and saturated fats should all say 0 on their label. Is that accurate? Is there a safe amount? What do you kind of educate your patients with high cholesterol about?
So trans fats definitely are a no-no because those are really toxic to the body. They're just not good. There's no positive to them whatsoever. Saturated fats, I think that's very tough if you're not, if you're looking at a nutrition label, you definitely want that as low as possible. Obviously, if you're not a plant-based eater, you're going to get saturated fat when you eat anything from the animal. And so it's almost impossible to be completely saturated fat-free. But it is saturated fat. It is animal fat that tends to really mess with the cholesterol. So I do recommend leaning towards a higher plant-based diet and a lower animal-based diet if you struggle with high cholesterol. So it's not necessary to go fully plant-based because some people will be like, hell no, I'm just not doing it. Okay, that's fine. But then maybe think about, if how many times you eat per day, make a third of that plant-based. Right. And maybe that's not hard. For breakfast, it could even be just, cereal and milk, oatmeal. And I do plant-based milk, right? Oatmeal, a smoothie. There's different ways to go plant-based on meals that are actually pretty easy, as a snack, apple and nut butters, right? That's healthy fats, not saturated fats. And so I do recommend going more plant-based. That also, and guys, I want to point out, I'm saying plant-based and not vegan. Right. Oreos are vegan. Oreos are not plant-based.
Can I just eat Oreos all day and be fine? Because it's vegan.
Exactly.
And they have gluten-free. So like gluten-free vegan. I could just eat Oreos.
You could, except no, that's not plant-based. No, still filled with sugar and crap and trans fats, actually, and all things that are horrible. So, and I do want to just point out, gluten-free is not healthier unless you have a gluten intolerance. It's actually got more calories most of the time.
And more sugars.
Yes.
Yummy.
Yes, I'm gluten-free because I have to be, not because I want to be. It's not the healthier choice. But plant-based is different. Plant-based is eating plants, eating things from the earth. And so vegan and plant-based are not the same. So I do want you to consider that. So I would definitely look for higher fiber foods. For example, like if you are going to have, I'm just going to give an example. If you are going to eat pasta one night, okay, that's not going to affect your cholesterol that much, but maybe choose a red lentil or a chickpea pasta, which is higher in fiber, just because then it helps with the cholesterol as well as gets to be a yummy pasta. Maybe one day, instead of making pasta bolognese with beef, you try pasta bolognese with lentils. Don't freak out. You try it. You love it, great. You hate it, don't eat it again. But at least you're open-minded.
Yeah. Or half
Right?
and half, right? Like I've done that with sloppy joes, for example. Like I've done half meat and half lentils, and then you combine them all and you don't even know.
Yeah. And the same thing is, if you're not willing to be plant-based on your meat, on your animal items, start going half and half beef and ground turkey breast, chicken breast, not ground turkey, not ground chicken, because that's going to include the fat and the skin. And then you're right back where you were before. So you do want to then combine. So when for example, Trader Joe's, I do most of my shopping there. They have a 96% lean beef. I love that. And then I will buy a pound of that and a pound of ground, whatever's cheaper, chicken or turkey breast, and combine the two. And so it's got fat in there because the beef is still in there. But because you're getting just ground breast product, you're not getting the actual saturated fat in there. So there's different things you can do to start going more plant-based. One of my hacks for myself, because I can't have dairy, is if I want to have some kind of creamy, like an Alfredo or something, instead of using cream, very high in saturated fat, I take a can of white beans, like northern beans, cannellini beans, juice and all, throw it in a food processor, toss in just like a smidge of probably like half of a teaspoon of agave or honey, just because dairy products are sweet, beans are not, and blend that up until it's super smooth. And I add that as my cream-based item, very high in fiber, no fat. Yeah, no fat, super creamy. Does it taste like half and half? No. But does it give you that creamy mouthfeel? Yes. And so, okay, awesome. I'm willing to try it for the good of my health.
That's so awesome. Yeah, I haven't thought about that. Alfredo always makes me sick anyway. Like any kind of like lots, like those super cheesy pizza, things like that, like all the like the white pizzas. I can't do them. A lot of people can't digest dairy anymore. I think I had a recent post on my social media about this, which is that I was taught, I think over 65%, but right now it looks like the new statistic is 65% of adults do not have lactase anymore. So we cannot digest lactose just in general. So pretty much everybody, again, not lactate, but should take a digestive enzyme that contains lactase.
Yeah.
If you're going to, or just don't.
And this could be even a very simple also. An easy way to go plant-based, stop cooking with butter and cook with olive oil.
I like avocado oil too. Do you like avocado oil?
I do. And avocado oil has a higher flash point, a higher heat point. So I think a lot of people are not familiar with like the burn point of oil. And when you use an oil that does not tolerate heat well, and you use it for too high of a heat, it turns it into a trans fat. And so that toxic fat we were talking about earlier that we should always avoid, you think you're doing, for example, if you cook with extra virgin olive oil, you are most likely taking something that's very healthy and turning it into something extremely toxic, because the flash point, extra virgin olive oils typically are meant to be a salad dressing, a dip for bread, something that isn't really exposed to a lot of heat. Regular olive oil has a higher flash point, so you can actually saute with olive oil. You can cook with olive oil, but not extra virgin olive oil. Avocado oil is even higher than that. Grapeseed oil is higher than that, right? So understanding, and there's plenty, if you go on Google, obviously go to a reliable source because you'll see 15 different answers, but go look at flash points of oils and you'll start to see. But oils are plant-based. And so even if you just replace butter, real butter, with plant-based butter or plant-based oils, that's even just one way to reduce your saturated fat.
Really nice. Yeah, I like to use avocado oil because sometimes I'm not paying attention when I'm cooking and then things accidentally get too hot. So we do our best. Interesting. And I don't know how I didn't put this together, but the extra virgin part, like you don't want that to be what you're cooking with. You want olive oil, but I've just always assumed, oh yeah, extra virgin. I don't know why.
Well, I mean, a lot of people don't know the difference between the two anyway, right? So like extra virgin, regular olive oil, and because extra virgin, EVOO, became so popular with Rachel Ray, and she cooked with it, right? So now if you go in the stores, it is so difficult to find regular olive oil.
Olive oil, yeah.
Yeah, you like really have to hunt. Extra virgin olive oil, there's like 50 of them. But
Mhm.
regular olive oil is difficult, much more difficult to find. It's there. You just have
Yeah.
to really pay attention. So,
Mm.
um, those are just different things you could do. Real quick, talk to me about your idea on eggs. So eggs are high in cholesterol,
Mhm.
but yet they're very healthy for you, and it's not necessarily
Mhm.
cholesterol that raises cholesterol. So, what are your thoughts on eggs
Yeah.
and shrimp?
I don't tell people to avoid eggs if they have high cholesterol. I know that some doctors do. I don't. There are other things. I'm more about giving you more options than taking away your stuff. So what I like to say is focus on really high fibrous foods, focus on garlic and onion, things that boost your HDL like extra virgin olive oil, beans, lentils, avocado, things like that, versus avoiding certain things. What I do say is if you're going to eat something processed or packaged, make sure that on the label it says zero trans fats and zero saturated fats, right? Avoid your refined sugars, things like that. So, like, obvious kind of overall tips about adding in more versus removing other things, because there is so much kind of back and forth data about eggs. I I'll tell people to eat them when they have low cholesterol. So I suppose maybe by that standard, I should say the opposite. But I don't tend to. Most people aren't eating eggs every day. A lot of my patients aren't. Maybe some people are, but
Yeah. So I know with mine, I would definitely, when I tell them both shrimp and eggs specifically, because they're such a high cholesterol food, and there is so much controversy to your point on is it
Mhm.
good, is it not good? I do say basically like I wouldn't eat either one of those. Like shrimp, keep it to once a week maybe,
Mm,
and eggs, let's maybe two, 3 times a week, and potentially cut your egg amount with egg whites. And I'm not
mm,
saying just use egg whites, but like if you normally have 2 eggs, do 1 egg and a quarter cup of egg whites.
yeah. They're also
Instead
really high in calories too, right? So if you're
of, Mhm.
trying to lose weight, then that certainly.
Yeah, because all of the not all of the nutrition, but a lot of the vitamins and stuff you get from an egg is in the yolk. But that's also where you get all of the fat and
Mhm,
all of the cholesterol. So when you move to the egg white, you still get that protein. So I don't say necessarily take all the egg yolks out, but definitely reduce the number of them,
mhm.
just to see if you can move your number.
Yeah,
Yeah.
yeah, for sure.
So
I
moral
think
of the story
yeah.
is that there's a variety of cholesterols. HDL, remember H healthy. That's what you want. You want your healthy HDL to be on the higher side, and then the rest of them, just to make that easy, you want them to be on the lower side. The number that doctors aim for is 200. Is that still accurate, Dr. Katie?
I like to say
200?
under 189 total.
Ah, okay. It's
Mhm.
getting lower. Okay.
Mm. Yep.
Go ahead.
Oh, no, you're good. And then just, about there are a variety of different medications that we didn't really touch on because oftentimes there are so many other things that we can do dietary wise, supplements wise, before we try it, lifestyle wise, before we do medications. But sometimes if somebody's cholesterol is high enough, you really don't want to refuse medication just for risk of heart attack. So,
Yeah, I think it's a super good point. I think it's important for everybody to hear very seriously that Dr. Katie and I are not anti-medicine, but
mm-mm.
it's kind of, this is probably a horrible analogy, but it's kind of like when you're like punishing a kid, right? There's the scold, there's the timeout, there's actual grounding, there's a spanking. Like you don't just like spank.
Right.
Right. And that's how I feel about medicine. I
Yeah.
feel like, okay, there are things to be done first. And if they don't work, you go to medicine.
Right.
That's why it's there. It's not necessarily, I don't believe it should be your first course of action,
Mhm.
but I absolutely believe it should be in,
The realm of
the
possibility.
option. Yeah.
Yes, yes, for sure, and if you're not well controlled and you've tried the natural things on and off, or you feel unconfident about your ability to change your diet, or you're just somebody who doesn't want to, then stay alive and medication might be your first resort. Whether you're on a statin, a fibrate, whatever, that might be what's keeping you okay. So it's not, this is not meant to be a talk that's like, exactly, that's anti-meds, not at all. Just that there's a lot of other things that most people can do, or at least some people can do before you go to a medication.
Yeah. And right. A lot of it depends on how early you catch it.
Yeah.
And if you're catching at the end stages, no, you may be going directly to medication. I mean, right? And that's
Yeah.
why don't do anything based on what we say until you have a discussion with your doctor,
Exactly.
because that will really determine the proper protocol.
Yeah. Cool.
Awesome. Dr. Katie, you're so smart.
Oh, thank you. So are you.
All these big words, you don't have to look them up. You're just like, let me spell that for you. Okay.
Eleutherococcus. Thank you,
I feel like
viewers. We've had a few here today. So thanks for watching. If you ever have any questions, hopefully you know how to get a hold of Theresa and I on Instagram or Facebook, emails, Is there anything else? I think we're good.
No, I think that's it, guys. It was good. It's been a long time since we've gotten together. So I'm thank you for the viewers that were here at present time, and then for all of you that are going to watch it later.
See you guys.
Bye.